I got into advocacy work at the age of 14 because I realized there was so many things that had happened to me as a person. There's stigma, there's discrimination, there is poor adherence, there is that kind of denial of like, why aren't other people like me and things like that. So I realized a lot of people are going through this.
Something that I will always highlight is community.
And I'm a co-founder of a Positive South Asian group.
When I was diagnosed, the doctor gave me a brochure for a positive women's group, and it was about 3 weeks later I went to that group just to meet the other women and to seek support.
For me personally, I didn't immediately go out looking for like support groups and so forth. I knew quite a few people who had HIV and they were really good supports to me, and I knew lots and lots of people who were involved in some capacity with the community.
I decided to, get more information, learn how to support communities, but also got interested in becoming, like the face of HIV as a young child, as a young person.
I definitely was participating in a lot of community action in those days, going on street marches, going to rallies, going to vigils.
And yeah, that's how I got into the space and, started talking to different people, being called to schools, being called to communities, working with different organizations to support them, improve their HIV programming, but also, make sure that people are receiving the right information.
Yeah, no, so I wasn't a part of any activism or anything. The only thing I felt like I needed to do, which was to give back and was to start volunteering.
Well, I've been volunteering for LPV.
For the moment, I volunteer with LPV.
So I started doing that with Thorn Harbour.
Join the Positive Speakers Bureau.
Talking about your experience to different people so they understand that it's just not what they thought it was.
So these are like year 10 high school students.
Like go to chats and just like discussing with the South Asian community of what HIV means and like being peers for them.
And also educate them about their own sexual health and the choices that they make in their own life.
Talking to corporates about HIV for World AIDS Day.
It's amazing because we are all South Asians, and like the way we grew up and our culture and our family is very similar. So most of them, the members of the group, they haven't disclosed to family. So we're sharing it together, and we're like, we're all in the same boat and we're there for each other. So it's very helpful to have that kind of community, actually.
There are so many different stories that are worth sharing. People that contract HIV in different ways, not just through sexual transmission.
I felt really empowered being able to give back and help out with that campaign.
So over those years of living in Melbourne and being part of the Positive Speakers Bureau, I felt really proud of being able to be in a position to do that. But I was still fearful of stigma for my children because there's stigma by association, and I didn't want the community where I live to find out that I was living with HIV and how that would impact on my children going to school. So when I did talks for the Positive Speakers Bureau, I said I'm not going to go to any schools within my 10 kilometre radius of where I lived, so nobody would know me.
One of the things that I did to get over that stigma or to get past that stigma was in about mid-1990s to come out as HIV positive to the world.
I wasn't specifically involved in HIV activism like many people were during the 1980s.
Living in Sydney in those days, the gay newspaper used to come out every week or every fortnight, and it would have pages and pages of obituaries.
But I wanted to write a book about my travels, particularly through Africa, and because that really changed my life, and I just felt it was a story I wanted to tell.
You'd see a half familiar face at least, and you'd be like, oh, I remember him. That's sad.
And I didn't write the book and have it published until 2015, was because I felt that I couldn't talk about HIV.
And by the mid-1990s, I lost my partner, unfortunately, to AIDS in 1994. And at about the same time, the internet was just starting to come into existence. And I created a website, as you do, and I came out to the world via a website. It was probably called something like Paul's website. But started writing about my experience with HIV and publishing random bits and pieces on the internet.
And I felt like if I didn't write about HIV, I would be perpetuating stigma.
I have kicked that stigma out of my life by saying I'm not going to be subject to that sense that it's something shameful, something to be hidden.
I just got sick of living two lives. There was my HIV life and all the friends I'd made through the HIV community. And then there was my other life of all my other friends and my motorcycle friends and the school mum friends who didn't know about me living with HIV.
It's also brought me in contact with a lot of incredible people, particularly in those early days when people maybe in Central Australia or in Iowa or in Eastern Europe might be just having their first exploration of the internet. They come across my website, and I used to correspond with a lot of amazing people around the world.
And from then on, I wrote a second book, and that was really about HIV because that was about the diagnosis in London and the travelling on the Silk Road.
That's the point at which I both started kind of being public as a person with HIV, but also that gave me the opportunity to say, well, this isn't something that's a burden, and it isn't something that defines me.